All right, so now we're going to look at the microscopic examination of urine casts. So we're going to look at how casts form. We're going to look at what hyaline casts are, cellular, granular, waxy, and pseudocasts. So casts will form in the lumen of the kidney, in the distal convoluted tubules, and the loop of Henle. They're basically molded into the shape of the tubules, with Tam-Horsfall mucoprotein comprising the matrix. And often we can see casts with cells that are present in the tubules at the time of the cast formation. So the factors that affect urinary cast formation, urinary stasis, acid pH, high solute concentration, abnormal ionic or protein constituents, and they can be indicated by the presence of urinary protein. Casts can be present in the absence of protein, and the microscopic examination for casts is pretty important. So casts will have parallel sides with rounded or blunted ends, and then they vary in size and shape according to the tubules in which they were formed. They can be convoluted, straight, or curved, and they're cylindrical in shape with no dark edges. If they have dark edges, it's usually a contaminant. So the width of the cast will indicate the diameter of the tubule in which it was found, or formed, So broad casts are formed in pathologically dilated or atrophied tubules or in collecting tubules and indicate renal failure. Casts are always renal in origin and indicate pathologies that range from glomerular damages, tubular damage, renal inflammation, renal infection. So when we look at broad and narrow casts, we can see fine granular casts and white cells. So here's some narrow casts. These are fine granular, and then this is a broader cast, and then a bunch of white cells surrounding. So we will classify our casts based on appearance and contents. So we'll look at hyaline casts, red cell casts, white cells, epis, granular, coarse and fine granular, waxy, fatty, and mixed casts. So when we look at the casts, we can look at the sequence of degeneration. So they start as cellular casts, then they become coarse granular casts, then they become fine granular, then they become waxy. So waxy are about the oldest cast that we have. So how do we enumerate? They're counted on low power, so your 10x, more frequently seen along the edges of the cover slip, and they're reporting according to type and range seen. So if you see hyaline cast 0 to 2 per low power field, 2 to 5, 5 to 10, 10 to 20. So for example, you'll report out hyaline cast 5 to 10 per low power field. So when we look at hyaline casts, these are the most frequently occurring casts in the urine. They're basically gelled Tam-Horsfall protein. Sometimes we can see inclusions that are incorporated while they're in the kidney. They're basically only protein. They have low refractive index. They're really, really hard to see, so it has to be viewed under low light. They are colorless, homogeneous, transparent, and have rounded ends most commonly. So this is an example of a hyaline cast and a bunch of red blood cells. So we can see hyaline casts even in the mildest kind of renal disease. It's not associated with any disease in particular. And we can see a few hyaline casts in normal urine. We can see them often after like intense physical exercise or in physiologic dehydration. So here's a whole bunch of other. There's one here, 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 here. So you can see a lot of them in this, and one up here, and a lot of them in this field. Here's another one. So this is another one with a filter. So here's one here, and here, and here. And it looks like if we focused it, there might be one in here too. So we have to hit the fine focus to look underneath it. This using phase contrast microscopy. So as you can see them a little better, and you can kind of see the components of it as well. So then we can see red blood cell casts. So these are literally exactly what I just said. They're casts that have red blood cells in them. So remember, casts are formed in the tubules, and they can have cells and things that were in the tubules at the time of formation. So in this case, this would indicate there was blood at the time of formation in the tubules. So red blood cells can appear brown and almost colorless. They may contain only a few red cells, or there may be so many cells you can barely see the edges of it. If the red cells are still intact and the outline are still detectable, then the cast is termed a red cell cast. If it's degenerated to a reddish-brown granular cast, then the cast is a hemoglobin or blood cast. So these are always pathologic, and there will be hematuria present at this point. And conditions will include acute glomerulonephritis, lupus, good pastures, bacterial endocarditis, renal trauma or infarct, pyelonephritis, congestive heart failure, renal vein thrombosis, or periarteritis nodosa. This one's pretty cool. This is a convoluted red blood cell cast, so it's all from the convoluted tubules. It's pretty neat looking. But you can see all the individual red cells all stacked up on one another. Here's some more red blood cell casts. So we look at white blood cell casts. So these casts will contain most white cells that are primarily neutrophil in that protein matrix. They can be few in number, or there can be tons of white cells in them. If the cells are still intact, we can sometimes see the nuclei. As they degenerate, the cast becomes granular in appearance. So we can see these present during renal infection and inflammation, in acute pyelonephritis, interstitial nephritis, lupus nephritis, and glomerular disease. So here's one with a little less white blood cells in it, but you can see the matrix and the outline very clearly with all of them interspersed in between. Here's some more. This one's stained. Then we can see epithelial cell casts. I don't have a lot of good pictures of these. These are not as commonly seen. We can see these after exposure to nephrotoxic agents, viruses, damage that accompanies glomerular injury, and rejection of a kidney allograft. They form as a result of stasis and desquamation of the renal tubular epithelial cells. They're rarely seen in urine because of the infrequence of renal diseases that primarily affect the tubules, like necrosis. They can be either arranged in parallel rows or haphazard, and they vary in size and shape and stage of degeneration. Cells are arranged in parallel rows. These are believed to have been from the same segment, whereas the irregular arrangement are from different portions of the tubule. So again, this is an epithelial cell cast. We can see mixed cell casts that will have red cells and white cells mixed together. Here's a red cell and a white cell. And some more. These are mixed casts, some granular casts, partially degenerated renal tubule epithelial cells. Again, stained. So then we can look at granular casts. So these can be the result of degeneration of cellular casts, or they might represent direct aggregation of serum proteins into a matrix of Tam-Horsfall mucoprotein. So initially the granules are large and coarse, but when urine stasis is prolonged, they break down to finer granules. So it really doesn't matter if you determine whether it's coarse or fine. It's not clinically significant. It's just a granular cast. So either way, that's significant. So finely granular casts contain 5 granules that can appear gray or pale yellow. Coarse granular casts have larger granules that are darker in color and often appear black because of the density of the granules. So here's a broad, coarsely granular cast that's looking very black. And then these are some of the finely granular casts, not as dark. So, granular casts usually indicate renal disease. They can be briefly present after strenuous exercise, however. So these casts have remained in the tubule for enough time to allow for the degeneration of cellular components, and sometimes they can be confused with casts that have bacteria or crystals incorporated into them. So here's a couple more coarse granular casts. And then here's, this is a bilirubin stain cast, and this is an SM stain cast, but again, we don't typically use stain. Waxy casts are here. So these are waxy casts, and then there's obviously some red cells right here. That's a red cell, some white cells. So waxy casts are found in urine from patients that have severe chronic renal failure, malignant hypertension, renal amyloidosis, diabetic nephropathy, acute renal disease, tubular inflammation and degen, and during allograft rejection. They have a high refractive index, they're yellow or gray or colorless, they have smooth homogeneous appearance, and they frequently occur as short broad casts with blunt or broken edges, and they often have cracked or serrated edges. So it's been postulated that waxy casts result from the degeneration of granular casts. So here's a waxy cast, and you can see that often we'll see the notched end in, and that's very common of a waxy cast. And then these are amorphous urates that surround it. We'll talk about more about amorph as well. This one here, you can actually see some more kind of notched edges. They almost look like an old rubber band. So here's some more convoluted waxy casts. So fatty casts, we can also see fatty casts, and they either have incorporated free fat or oval fat bodies. Sometimes there's only a few fat droplets, other times it's completely composed of fat. If the fat's cholesterol, the droplets will be anisotropic, so you'll see that Maltese cross. Isotropic droplets that have trigs will not polarize, but they'll stain with Sudan 3 or oil red O. So here is a fatty cast. We can see these during fatty degeneration of the renal tubular epis in degenerative tubular, nephrotic, diabetic glomerulosclerosis, lipoid, nephrosis chronic, glomerulonephritis, Kimmel-Still-Wilson, systemic lupus, renal poisoning. We can also see mixed casts. This one's got some bacteria. We can also see what's called pseudocasts or cylindroids. They look like casts, but they have an end that tapers out like mucus. The exact site and mechanism of their formation aren't really known, but they usually occur in conjunction with casts, and they're considered to have the same significance. But we typically don't classify them separately. Often they're called hyaline. So this one looks like it might have some other material in it as well. These are mucus threads, so we can see mucus very often in the microscopic. Thin, wavy threads that look ribbon-like with faint striations. We can see them in normal urine, but we can also see a lot extra in inflammation or irritation of the urinary tract. And some of the wider threads can be confused with cylindroids or casts. And a lot of the heavy mucus strands tend to incorporate white blood cells in them as well. Other things that we can see, here's some artifacts. These are fibers. This is a diaper fiber. This is a hair and a coarsely granular cast. And then yeast with pseudohyphae. They aren't casts, they're pseudohyphae. Here's another fiber and then another cast. So you can see the difference. Very, very heavy black outline versus not. All right, so that was casts in a very, very short summary. So your lecture code for today will be 2278.